This is Dr. Kemp, and this is a video on recovery after midfoot, hindfoot, and ankle surgery. The midfoot and hindfoot are depicted as the blue, green, and yellow areas on the left, and the orange and yellow area on the right. Common problems that occur in the ankle, hindfoot, and midfoot include arthritis, fractures, flat foot, tendon problems, and other sources of trauma. On the day of surgery, you'll have nothing to eat or drink after midnight the night before. You'll arrive at the hospital or surgery center on time. You'll then check in, and you'll visit with the nursing team and anesthesia team. I will see you right before the procedure to answer any final questions you may have. Your choices for anesthesia include general anesthesia, a nerve block where an anesthesiologist uses ultrasound guidance to inject numbing medication around a big nerve behind the knee, causing your foot and ankle and leg to go numb. In some cases, we'll employ a nerve block with an indwelling catheter that continues to infuse pain medication to keep the ankle numb for up to 3 days. During the procedure, you should remember entering the room and moving to the operating room table. You should not remember anything about the procedure. You will then wake up in the recovery room immediately after surgery, and typically recovery from anesthesia takes about 2 hours. Some patients will be discharged home at this point, others will require an overnight stay. When discharged home, it's important to note that you cannot drive yourself home. A family member or friend will need to drive you home. I'll also discharge you on appropriate pain medication. If you do require an overnight stay, typically it's a 23-hour overnight stay, and you'll be discharged home the day after surgery. The most important thing to remember about pain medication is to start taking it right after surgery, even though your foot and ankle may be numb from the nerve block. The reason is that eventually that nerve block will wear off, and when it wears off, you will have significant pain. It's important to have some pain medication on board prior to this occurring. The most important instruction I can give you for home is to elevate, elevate, elevate. You need to elevate the extremity for 2 to 3 weeks. You need to elevate the foot above the heart 90% of this time. You may be up out of bed or off the couch for short periods, including trips to the bathroom, to eat short meals at your dinner table. And when you're awake, it's important to get up every couple of hours just to move around, stretch, and deep breathe to help prevent pneumonia and blood clots. Proper elevation is pictured here. The best way to ensure you're elevating properly is to put your hand on your heart like you're saying the Pledge of Allegiance while lying down, and making sure your foot is well above your hand. It's okay to use ice after surgery, but it probably won't penetrate your splint or cast, so I think this is in general a waste of time. Elevation is more important. You will be discharged home in a splint. We'll eventually change that to a cast in the office. It is very important to keep your splints and casts clean and dry. If your cast does accidentally become wet or soiled, please call the office. If it's on a weekend, please go to the nearest emergency department. Typically after 6 to 8 weeks, we'll transition you from a cast to a cam boot walker. And at this point, depending on my instructions, you may be partial weight bearing, gradually increasing to full weight bearing in the cam boot walker. In some cases, I'll allow patients to go into the cam boot at 3 weeks, but typically you're still non-weight bearing for the full 6 to 8 weeks. Every patient's protocol is slightly different, but in general, you are non-weight bearing for 6 to 8 weeks after hindfoot, ankle, or midfoot surgery. Then you can be partial weight bearing using 2 crutches for an additional 4 weeks. Then full weight bearing after that. Again, each condition in each patient is slightly different, but this is in general terms. When you are non-weight bearing and partial weight bearing, you may use crutches, a walker, or even a rollabout if you have to cover long distances. If you need help in obtaining these items, our office staff would be happy to assist you. You may shower after surgery, but it is still important to keep your cast or your splint dry. The best way to do this is to obtain a commercially available cast cover from your local pharmacy. In general, you will see me postoperatively in the following schedule. First visit will be 5 to 7 days after surgery for a cast change and a wound check. Then you'll see me 3 weeks after surgery for suture removal and a cast change. And then at 6 weeks post-op, you'll see me again for a cast change to a cam boot walker. Then you'll see me at 3 months post-op, typically for a final visit. Stitches are removed at your 3-week appointment. Swelling is normal after surgery, especially foot and ankle surgery. You may swell or have some discoloration of the foot and ankle for 6 to 8 months after surgery. Once again, this is normal. It will slowly resolve, and some tricks to decrease swelling include elevation, and after 2 months, obtain foot massages. Physical therapy can also help, and compression stockings can also help. Compression stockings can be obtained at your local pharmacy. When you're in your cast, it's important to wiggle your toes and try to move the ankle up and down as frequently as possible. It's okay to try to move the ankle, and specifically it's okay to remove the toes even though you're in a cast. You'll be in physical therapy after the 2 to 3 month point, and sometimes earlier depending on the condition. I believe that the guidance of a physical therapist is important to your recovery, and will recommend this at the appropriate time. One of the most common questions I get asked is when you can go back to work. In general, if you have a sedentary job at a desk, you can go back to work after 2 to 3 weeks. If, however, you are on your feet all day, then you will need to wait at least 3 months till you go back to work. Total time to recovery is 6 to 8 months. I consider you recovered when you get out of bed, place your foot on the ground, and you have no pain and you don't think about your foot. Now, because this is such a long time, you must be committed to and dedicated to the surgery and the recovery. It is important for us to work as a team, and together we can obtain the best possible outcome. Good luck, and thank you for watching this video.